My son came in, he said, come on, Bo. And Bo looked at him, he looked at me, and he sat on my lap and said, you're not your dog anymore.
This pen. No one's
Oh, I always have extras.
No one's attached to this.
No.
Yeah, he's just shut in.
But today I came from home.
Okay, so I'll cross out 32 and write.
Yep.
Do we know who's on
No, Joe Larson, I don't know.
Joe's the
So probably,
guy.
Oh.
IT is probably one of them.
Okay.
Sharon, do you have an extra pen?
I do. I have.
Oh, okay, never mind, everybody.
Okay.
Okay, so
Um,
this is IT.
My cell phone says it's 6:01, so I will call the meeting of the Trempealeau County Board of Health for the October meeting to order at, as I said, 6:01. Certified that the open meeting law requirements have been met, and we have a public comment period. So if there's anyone out in the public that's listening that would like to make a comment, call in at 715-538-1770.
So are we still short pens? Do you have pens?
I have extra pens.
I know I have some, I couldn't find them, but I did find them. So you know what I do?
Second call for anyone from out in the public, if they'd like to make a comment, 715-538-1770. And the third and final call for public comment, the number to call is 715-538-1770. Since I don't hear the phone ringing off the hook, I'll close public comments at 6:02. Agenda, we have a 12-item agenda, and I would like to move number 9, the director's report, and the review of agency budget vouchers up after number 5. Is there an objection to that? And could someone make a motion to approve the agenda as suggested?
Motion to approve.
Okay, and a second?
Second?
Okay, motion by Johnson, second by Bradenbach to approve the 12-item agenda with moving number 9 and 10 up after number 5. Comments? All those in favor of the agenda? Aye. Opposed? Okay, we will go with that. Carol sent the minutes out. We needed a motion to approve.
So moved.
And a second?
Second.
Okay, a motion by Johnson, a second by Miller to approve the minutes of our last meeting. Any questions? All those in favor of approving the minutes, say aye.
Aye.
Aye. Opposed? There we go. I think the biggest topic for tonight will be the updated immunization policy, and Aaron's going to probably introduce Joe Larson and take it from there.
All right, thank you, Beth. I do want to introduce Joe Larson. Joe is there on the screen. Hello, Joe. Joe is a public health nurse. He works for the Department of Health Services Office of Policy and Procedure Alignment. Krista Cupp was in the interview process and helped you guys pick the job for me. That is Joe's boss. So he's a public health nurse consultant. He is a resource. Krista is the liaison, and Joe and his new counterpart too, the health educator, they're the liaison between me, local agents, and the state. So we call them whenever we're trying to figure things out on a local level. So represents the Western region. So Joe is a resource that has been used in the past, but I think he's always gone through Barb in the past instead, but he's a resource that the public health nurses can use directly. It doesn't necessarily have to go through me, and so I want to encourage that as well. So Joe came to the office today and talked with the nurses as well about some stuff. I haven't seen Joe since that happened, but to introduce himself as a resource for them moving forward. So so that's good. I've invited Joe to speak, to answer any nursing-specific questions about the policy, the change that I'm proposing, and he might be able to speak to some degree, whatever he's comfortable with, on kind of the state's position, if you guys have questions for Joe. So we also have, obviously, we have Rick here for the core council for any legal questions that may come up, and I've asked Dr. Hodes to come along as well for medical advisor input on this. So I think it's a very important discussion, and I'd like to move on. So what I'm asking for is to adopt a new policy and procedure that we can go through and talk about, and to replace it with to adopt the new one to replace the current one. And I would like that to take effect on November the 1st, to give us a little bit of time to work on a process change, because they're very different policies, and it'll have a lot of changes that we'll need to work through. So I think the first thing that I would like to say is that prior to the current policy being adopted, Trempealeau County used to be a leader in the community. We used to go out into the schools. We used to vaccinate hundreds of kids for vaccine for children in the schools. Then in 2016, for probably well-intentioned reasons, I'm certain, we adopted the current policy, and it has had some unintended consequences. We have strained relationships with the K through 12 schools because we're not able to vaccinate their kids because they need 3 forms of identification in order to get a vaccine. And obviously require a consent form and all of these barriers that have been put into place. We're not vaccinating nearly the volume of people that this county needs, and other people are picking up that slack. Mayo, clinics, Tri-County, other counties are covering that for us. St. Clair Health Mission in La Crosse. These are the other avenues that they have to go around at the school level to get the kids vaccinated. The other thing I think that's important to note is that the 3 forms of identification that are required in the current policy, we're the only ones, public or private, in the entire state that require any form of identification for a vaccination. So hospitals, clinics, St. Clair Health Mission, public health departments, we're the only people that have a policy that resembles this. So I would like to propose that we review and move through a new policy. It's modeled off of the state has a template policy for vaccination for minors. It's 95% of that policy. There are a few additions that I think will give us a strategic advantage, the way that it's written, moving forward with services we're able to offer. We'll be able to get back into the schools to do vaccines for children. That could be COVID, that could be influenza. We'll be able to work on process improvements to more efficiently and effectively deliver vaccines for children in the health department or outside of the health department. We can work on some of those strained relationships. We can leverage volunteers and other vaccinators to do some of the work for us. So if we wanted to do like a back-to-school clinic, it wouldn't necessarily have to just be our nurses. We could use the school nurses. We could use volunteers like I happened to do in La Crosse for the COVID vaccination when it first came out. It will align with our current maternal child health grant and objectives for health equity and community engagement. That'll help us pursue that objective for a grant for 2022. And much like you were talking about with the ARDC problem, I think that it will also help us streamline using WIC to get folks into the Vaccine for Children program. That often they are the same clients, and many counties work together closely with the WIC and the nursing departments to align those services together so that it's as easy as possible for them. So I think at this time, maybe we can go answer questions, or maybe we want to read through the proposed policy. Does anybody have any direction that they'd like to take it?
Dr. Hodis, you look like you want to say something.
No, I don't want to say anything. I actually have looked at the proposed changes, and I can't give them verbatim, obviously, but it made sense to me to align the Trempealeau County policies with the rest of the state, and there are advantages to how that was set up. Aaron just kind of hit on a number of points, and I would endorse those changes.
So maybe we could go through this together.
Sure.
Through the policy together, and then if you have any questions about any nursing specific questions that may come up, or legal questions, then we can tackle that. So some of the major changes that happened here. So attachment C is the new policy. It's based in large part off of attachment B, which is worth looking at if you would like to do that later. So attachment C, the current policy, the major changes were the essential public health services. This is a model that's based, the core of it is health equity. They recently changed the model in 2020, and I've just updated those, the applicable 10 essential public health services that align with this policy. So the other thing I did was add a purpose statement to align some sort of intent, and so I'll just read that out loud. The Trempealeau County Health Department supports the belief that parents and guardians and legal custodians are present when minors, children receive the vaccine whenever possible. The additions are, Trempealeau County Health Department is cognizant that situations can and do occur when a parent, guardian, or legal custodian cannot be present. This can serve as a barrier to receiving needed immunizations for minor children. Other examples of barriers to care include, but are not limited to, the location of vaccination services, language barriers, citizenship or identity verification requirements, means of transportation, complicated scheduling processes, and long wait times, etc. Trempealeau County Health Department is committed to addressing and removing barriers to vaccination services whenever possible and appropriate. Towards this goal, Trempealeau County Health Department has adapted the policy below from the one provided by the State Immunization P&P Manual. That's this one. Attachment B. So those are just intent statements, but kind of point us in the right direction on what we should and shouldn't be doing, and just stating that we're in the business of removing barriers and vaccinating more people. And that should be the focus. The policy is, this policy allows for vaccines to be administered to a minor when a parent or legal guardian, or legal custodian is not physically present at the time of vaccination when specific criteria can be met. So the current policy does not allow this. Back to, in particular, the public health nurse or other credentialed vaccinator, herein referred to as vaccinator, shall assure and document that the parent, guardian, or legal custodian has requested the requested and appropriate vaccines, has had an opportunity to provide information about allergies and contraindications and precautions, and understands the minor and major adverse events that may occur as a result of immunization. The major change there is the definition of vaccinator, and then we changed that throughout the rest of the policy. This invites use of volunteers or school nurses, or Dr. Hodis, if you want to come, we can get you set up and we can vaccinate. And And then in bold, there are no federal or state laws requiring a signature of a parent, guardian, or legal custodian for the immunization of a minor. So Mayo, Gunderson, Tri-County, all of them, they all have a policy when minors show up. If for whatever reason mom or dad can't be there, whoever the guardians are, most of them are willing to make a phone call to the parent, and if the vaccinator can feel reasonably comfortable that they understand A, B, and C, requested their vaccines, worried about allergies and adverse events, then they can give that verbally. There's no requirement, no consent form is required, although preferred. The procedure goes through a number of different ways in which they will get the proper information. And if, in fact, it has a process for how they will determine if the parent or legal guardian is not present at the time, which includes the phone call. So I'll just continue reading. C, the vaccinator. Oh, B, top of the page. If a parent, guardian, I'm just going to say parent. If the parent cannot accompany the minor child, the individual accompanying the minor shall present a written and signed permission from the parent. The permission must meet the following conditions, the same 3 conditions as before. Use the vaccine administration record, fulfills this requirement. This is a document that that is linked here in there, but it's a document that we currently use and everybody uses. So, C, the vaccinator is responsible for assessing and evaluating whether the signed permission demonstrates understanding of the 3 conditions above. The vaccinator will then do one of the following. If the vaccinator determines that the conditions are met, they will complete the vaccine administration record, attach the written permission, add in the signature line, see attached permission, parent, guardian, legal custodian. If the vaccinator determines that the conditions are not met, the signed permission form, the vaccinator will attempt to contact the parent by phone. If the contact's not made, vaccines will not be administered. If the contact is made, the vaccinator will describe who is with the minor child, determine if the intention of the parent, legal guardian, to have their minor child vaccinated. If the vaccinator determines that the parent or legal guardian does not want the child immunized, vaccines will not be administered. If the vaccinator determines that the parent wants their minor child immunized and the conditions B are met, those were request appropriate vaccines, list contraindications, allergies, and possible adverse events. Date, time, contact person, those were the conditions. They'll complete the vaccine administration record, the form linked above, document the phone call on the vaccine administration record, including the date, time, contact person, assessment, evaluation of parent, custodian's understanding of verbal consent to immunize, attach the parent, custodian, written permission to the vaccine administration record. On signature line, write in phone call to parent and guardian or legal custodian, administer the vaccines according to the agency policy and procedure. Public health situation applications, accompanied minor without permission. If a minor is accompanied by an individual who is not the parent and does not have written signed consent, the vaccinator will follow the steps in C2 above. That was the phone call situation. An unaccompanied minor without permission. If a minor is unaccompanied and does not have a written signed permission from the parent, legal guardian, the vaccinator will follow C2 above, again, the phone call, or determine if the minor is an emancipated minor. An example of such minor eligible for assessment might be a married teen or teen parent. If the minor appears to be an emancipated minor, the emancipated minor could sign for him or herself. There are no federal or state laws requiring the signature of a parent for immunization of a minor. Minor foster children, due to many ways, and this is all stuff that's in the current policy as well, due to the many ways in which children become into foster care services, it's impossible to generalize. These situations could be handled on a case-by-case basis using the following guidelines. The vaccinator will identify the contact of the local Department of Social Services in a case and a need to verify who can authorize immunizations for the minor. Foster parents usually know who can authorize immunizations. When in doubt, confer with the social services contact. if the immunizations are authorized by the local social services department or the foster parent. If the foster parent has consent authority, the vaccinator will follow the steps outlined in B above. Minor foreign exchange students living with an American host family usually have a signed medical release from their parents authorizing necessary medical action. Under this situation, host parents could sign the required vaccine and attach a copy of the authorization form to the vaccine administration record. Minor parents, unmarried minors with children can sign for their children. Divorced parent or a step-parent. A divorced or step-parent may or may not be authorized by the court to control the child's medical care. However, if the person alleges that he or she is the parent and the vaccinator has no reason to suspect the contrary, the vaccine request should not be denied. The vaccinator does not bear the burden of proof that individual accompanying the minor is either is or is not the parent, guardian, or legal custodian. Multiple immunizations. When administering vaccines to a minor in a series, the parent, custodian, may be given extra copies of the vaccine information statement and unsigned copies of the vaccine administration record and instructed to sign and date each form prior to each subsequent dose. Any change in the contraindications or adverse events from the previous dose of the vaccine must be noted on the form. The parent must be instructed not to sign all copies in advance, but rather sign and date each one as close to the time of the immunization as possible. The form must be presented at the time of the clinic. It's the entire policy, but the major changes are replacing public health nurse with the vaccinator term and removing barriers, listing some examples in the purpose statement. I would like to vote to adopt this entire thing to replace the current one effective November 1st.
Make a motion.
Okay, so we have a motion by Miller, a second by Bradenbach to adopt the policy that Mr. Newberry just read to replace the existing policy. Time for discussion.
Okay, so I always ask this, has this gone to court counsel for review?
He's on.
Rick, that's a question for you.
Rick, can you hear me?
I heard the question of whether it was run by court counsel. I couldn't hear very well.
Okay, I just asked, you know this, I always ask this, has this policy gone to you for review?
I have taken a look at it, yes.
Okay. And do you see any problems?
I don't necessarily have any problems with it. I'm speaking strictly as a lawyer, nothing to do with the health stuff. That I leave that to the other professionals. It's always a little bit of a concern when minors showing up to get certain things done, and you don't know whether the parent is the one that gave the permission or someone else, particularly when it comes to a controversial topic. These particular days, but there are safeguards built in there with phone calls. If those are adhered to, can't make everything solid, proof and 100% liability free. So from a practical standpoint, it makes sense, but there's always a little bit of a concern.
Okay, thank you.
Anyone else have questions?
Just, Aaron, this policy then would put us, our county, in line with the rest of the state.
From my perspective, that from what all of the calling around and investigation I've done since I've started here and found out about the current policy and wanted to align it with the state's template, the answer to that is yes from me, but that's maybe a question you might want to ask Joe as a state consultant that has seen numerous policies as well. So.
I'm sorry, I missed the question. It's kind of quiet in the background.
Right now, we're having severe rumbling from the construction happening outside, so I don't know if that's interfering. Like some of the equipment started rattling, so.
Oh, there you are. I can hear you now. Thank you.
I'm loud.
So the question was, does this new policy put us in line with everyone else in the state?
Yes. The policy that Aaron has put forth here is based on the state immunization policy and procedure, which is put out by the state immunization program as a template for health departments. Many health departments around the state adopt the state P&P as it's written. Some do modify particular pieces to meet certain needs of their counties, such as what Aaron has done in here, some individual pieces, but for the most part, that state immunization policy and procedure, as long as it follows that, it's in line with much of the state. Correct.
Did that answer your question, Pam?
Yeah.
Anyone else have any questions?
Yeah, Joe, I'm wondering, this is Bert Hodis, I'm wondering, you had an opportunity to meet with some of the staff. I'm just kind of wondering how that all went, and was that accepted, and we have a way forward with that? I'm just kind of curious how that went.
Yes, I was very grateful to have the opportunity to speak with the nurses today. Spoke with them for a couple of hours. And some of the things that we reviewed were the old process and some of their concerns that they have potentially with the new process. Some of the things that I really took away as the major themes were really documentation. I think their concerns were around, in the old policy they had used the forms of identification to verify things like spelling, dates of birth, and things like that. So I think those particular concerns can be addressed with a really clear policy and procedure. They are definitely valid concerns with the process, but there are ways to potentially address those. I think that documentation was the big thing. Efficiency was another thing that we discussed in quite detail. And I think the burden of documentation at the moment with the current policy, not the new policy, but that burden of documentation puts a lot of stress and time on those nurses to make sure that everything is crystal clear, all the I's are dotted and T's are crossed. And again, I think, in speaking with Aaron, some of those concerns could be addressed with a really strong procedure and input from the nurses as far as how they could go about addressing some of those. So there is some concern. It's a major change in the policy, and I guess overall those were kind of the major themes that I heard from them. Hopefully that answered your question, but.
Yeah.
Mr. Johnson, do you have any questions, comments?
Well, it just seems to me like having one that would line up with the states.
Do you have your mic on?
Oh, no, I do not. It just seems like it makes more sense to have one lined up with the template by the state than it would be to have our own. I think it's obviously the right thing to do.
Dr. Kim?
And I will just add that I agree that this is the right change to make. I think it's an important step in making sure that we have the broadest access of the citizens of the county to our public health services, and that some of this was preventing access in the past. I can't even tell you where my children's birth certificates are, to be completely honest with you. So I wouldn't be able to bring my own kids here to get immunized if this were the policy that were in place. And I bet I'm not alone with that. So I think that this will be an important move for being able to serve the community better.
Sally, anything more?
I guess for me, in the work that I do, and we work with minors and we work with people, we aren't even allowed to ask for identification. we take them at their word, and we do provide services to minors as well. And it is about making sure that everybody who wants help and wants services is able to have access to it, and that we're not creating barriers, that we're creating pathways. And this is creating a pathway to a healthier childhood, So I'm absolutely in support of this.
The thing that I can add is the secretary at the Arcadia Elementary School had talked to me this summer about, can we have more clinics for the children, because they had a long list of children that couldn't get vaccinated because with the process we have, they can only do a small number on that one day once a month. And I know I did talk with Barb about it, and I did talk to Aaron about it, and I think this would help service more children. And, they won't have to go to La Crosse County to get their vaccinations. They can stay right here in Trempealeau County.
I think, well, I don't know if I'm allowed to do this. I think we can go to the schools and do that with this.
That's how they did it when I was a kid. That's where I got vaccinated, at school. My mom wasn't there. Just sent me back, yes, I know.
You took the permission slip to school?
I did, I took the
lined
permission
up?
slip, yeah, and.
I think the same with this policy, though, is that you're not going in and vaccinating people who do not want to be vaccinated.
Correct.
So I just don't see any problem with it.
And there is a statutory requirement we have to ensure that children are up to date on their vaccines within 40 days of them starting school in our district. So they have 40 days to get caught up. So they've got to do it somewhere. And if we can help with that, especially for folks who aren't insured, that's exactly what we're supposed to be doing, so.
I call the question.
Okay, I was just going to say, it kind of sounds like the consensus is that we're all in agreement. So all those in favor of approving the new vaccine consent form for immunization of minors, which would take effect on November 1st of 2021, say aye.
Aye.
Aye. Opposed? There we go. Mr. Larson, are you hanging around for the rest of the meeting? If not, thank you for coming.
Thank you so much for inviting me. I appreciate being here. And I will sign off and let you have the rest of your meeting.
Okay.
Thanks.
Thank you.
Thank
Joe.
you.
Thank you, John.
You're welcome.
So then we would move to item number 9, the director's report.
All right. I'll try to do this in the order it's written. COVID report, just to keep everybody up to date. The case rate was yesterday 38.1. In general, we're trending down. We're still in the red. We have 195 active cases. There are 7 hospitalized currently, and no new recent fatalities. We're at 49 since the pandemic began. Other activities in COVID, you may or may not know that starting last week, including today, we've had set up a weekly wing testing site. They'll test asymptomatic folks at the Annex in Independence, and it's every Tuesday from 10 to 4 through December 14th. That'll be available. I'm skeptical that it'll be around after that in the entire state. So that's my opinion, though. As far as vaccination sites, we've talked about before the strategy that we are using, and in some part because of our vaccination policy, our old one. We're using AMI as a wonderful resource and a great partner. They've been going to the schools, Arcadia, Whitehall, GET, Olivestrom, and Blair Taylor on a 3-week rotation, and doing first dose, second dose, and now boosters. There's been a large uptick in takers on the boosters because teachers are eligible and it's in their own backyard. Today, Arcadia had a vaccination clinic at the Wannock Center from 1 to 7. I stopped out there at about 4:15, and they were 35 people had gotten their shots. They got a couple of first dose people, a lot of boosters, and there were probably 10 or 15 teachers in line going out the back door because they just got off of work to get their shot. So a lot of interest in the boosters from the teachers, which makes perfect sense to me. They'll be in Whitehall tomorrow from 12 to 7 for the same expectation. GET from 4 to 6. Open to the public from 4 to 6. They'll be there for a couple hours before that for the students and the teachers. They already have 80 people, 80 teachers signed up just in the building that want the boosters on Friday. And then St. Peter's and Paul's Catholic Church, or the school in the basement of the church, from 2 to 6 on Friday will be giving vaccinations in Independence as well. So that's a brand new one, and hopefully they're only getting approved 1 week at a time. They changed the process, but they've all been applied for, and we'll know by late afternoon every Wednesday what we're gonna have the following week. So we have one for Oliva Strum scheduled for next week, pending approval, and then Blair Taylor the following week, and then we'll be back on the rotation with Arcadia, Whitehall, GET, St. Peter's and Paul. There's a number of different things. I'm sure you guys could speak to Dr. Hodis and Dr. Breidenbach more about, I've seen things about mixing. There's pending decision on a booster for J&J, a booster for Moderna, the mixing of the boosters, and if you got Pfizer originally, you got 2 doses of Pfizer originally, 6 months later, maybe you should get a Moderna. FDA's and the CDC's all going to look at that in the next coming weeks. And by the time we meet again, I'm certain they'll have made some sort of decision on that. There's also the 5 to 11 approval from Pfizer that's pending soon that they'll rule on, hopefully before next meeting. So just being mindful of that, and that those changes could come down. And if we're already scheduled in the schools, we're not doing anything with operations, so we don't have to manage any of that. AMI handles all of that stuff, which makes it really nice because we don't have to figure out the details of the operations piece, which gets complicated. And we've recently hired 3 new contact tracers that will be starting this week, varying hours on all 3 of them, but we've hired our first Spanish-speaking contact tracer, which I think will be a positive thing. So we're happy to, in the past, the contact tracers that we've contracted with, they've used the language line. It's already over the phone, so that makes it a difficult conversation. So a 3-person conference call with 2 different languages takes quite a long time. So that'll hopefully be an improvement. Who's next? WIC. WIC, we just recently hired the new WIC project manager, and just so everybody knows, the nutritionist job to replace Caitlin closes this Friday, so we'll be looking to replace that position soon. Hopefully that'll be taken care of by the next meeting. And just to note that WIC is not, they're continuing with no in-person visits until January the 15th, or it will always be 90 days past the end of the public health emergency, the federal public health emergency. So that will continue to extend as long as the federal government extends the emergency. Environmental health, we've had Dexter on board for a while because of COVID. He's been unable to complete his training for restaurants, but we are focusing on that. We're scheduling a lot of trainings where he can go out to several different counties, work with state folks at DATCAP so that he can do his 50 required inspections before he can go out on his own and start doing work for us by himself. So working on that. And then Jen went to the Wisconsin Environmental Health Association annual conference that was in Eau Claire a couple weeks ago. And then as far as the nurses go, they conducted Narcan training for the county jail here. And we did we transferred our adult Hep A vaccine, everything that we had to transfer to Monroe County to address the folks at Fort McCoy for a Hep A situation there. And also organized, Patty's been organizing the test site out at the annex. So once we got that started, she's the one who handles all of that. So grateful for that work. Do want to talk a couple things that, one more, Nanishka and Bree went to car seat installation training, and they're all certified. So whenever we get money, whenever we find money for more car seats, that's a program that we'll continue to align with WIC likely. So I don't see that one going away. And then the last one is me, the health officer. We're currently in contract negotiations for 2022. That's lead, maternal child health, immunizations, radon, WIC, et cetera. It's due in the middle of November, so working through that process has been a learning experience. As far as outreach, I think this is the last time I'll probably talk about this unless there's something notable. But I did meet with the behavioral health, Erica Anderson, the behavioral health supervisor, and talked to her quite a lot about possible shared objectives in the future. I met with the Department of Health Finance, Yvette with Carol, and kind of worked through our contracts currently and our budget. With that money, I was on the radio this morning with WTCO promoting the clinics that we talked about earlier, and I met with Butch in person there, and I also made it out to the Independence Library to meet with the librarian there, and we did our budget proposal, which I think Carol's going to talk about later with the executive finance. So that's what I have for what's happened in the last month. So I hope it's not too much, I'm sorry, but I feel like those are the major things.
Any questions for Aaron? Then Carol is going to tell us about the agency budget and the vouchers. Don't forget to put your mic on.
So we'll go through the vouchers. There's really nothing different here, but I would like to call your attention to the very first line. It's to the state. That's where we're paying. If you remember last month, we spent over $700-800 to the state. That was paying the 10% that was due to the state from the agent status program, which is the restaurants. This is for the 10% to the tattoo. So that's a separate license. We have one facility in the county, and we had to pay $35.50 to the state for that. The next item is, of course, all of our contract tracers. That's a $5,168 expense. That was since last Board of Health. A lot of the memberships are coming due now for the Public Health Department. We bought some of our flu vaccine, which now we're starting to give. Also to the schools as well. I think GET is getting some vaccines from us. Otherwise, that's about it as far as the vouchers. As far as the agency summary, I'm still running everything through the Public Health Miscellaneous Fund. So if you look through the second page where it says the Public Health on the revenue on the bottom, you'll see that's $134,000 that's in that budget. That's where I'm running through all the COVID reimbursement money. Through some of the stuff that I was going through recently with the clerk's office also, we found out that he didn't give us our journal entry of $61,000. That was from, it just left me. Sally, help me out.
COVID committee?
FEMA.
Okay.
Thank you, yes. Thank you. It was from the FEMA where they were supposed to adjust to all the departments involved. Ours was $61,000, and then when we get the money, then that will go to the general fund. And in reviewing things and talking to Paul, he forgot to give us our 61,000. So somewhere, somebody on that finance committee, keep an eye out that he does that journal entry for us. So, that was the big thing. I was actually skipping when we found that out. As far as our expenses, we completed some of our grants, so which means now we'll be flipping over into spending the remainder of the year in public health, the levy. I think that's about all I really have here today. So, thank you.
Any questions for Carol?
Did you find out that journal entry, did you find that out during your presentation for budget?
It was after that.
It was after that,
I had to
okay.
go ask him some other questions on the similar topics as to why something wasn't calculating out, and that's what we found out.
Okay.
So,
Good catch.
So now we're back up to number 6. We need a motion to go into closed session, and whoever's going to make the motion, it will read the description.
I make a motion to go into closed session pursuant to Wisconsin State Statute 19.85G to confer with legal counsel for legal advice related to the copying and retention of identification documents within the health department.
And a second?
Second.
Okay, a motion by Miller and a second by Johnson to go into closed session. So roll call vote. Killian, aye.
Miller, yes.
Ellison, yes.
Reinbach, yes?
Johnson, yes?
So we have to wait for a little while. It's 6:47 to go into closed session. Dr. Hodis left. The TV people got it.